Hello, my friends, and welcome to the Pathway channel. Today, we will discuss the psoriasis. And by definition, psoriasis is a chronic inflammatory disease. And I will not go deep into the pathogenesis, but it appears to have an autoimmune basis. It can be associated with arthritis, with myopathies, with acquired immune deficiency syndrome, and with enteropathies. It can also be drug-induced, and it can also be induced by trauma or local trauma, which we call the Koebner's phenomena. For completion, before going into the microscopic features, these patients, they present with this salmon-colored plaques, as explained by books, and it's covered by this adherent silver-white scale. And on removal of these scales, we will have some sort of bleeding, which is a pinpoint bleeding, which we call the Aspit's sign, and we'll explain under the microscope why we have this sign or such bleeding. The common locations for these lesions are knees, elbows, scalp, lumbosacral areas, or gland penis. And nails can be affected in around 30 to 40% of cases in the form of yellow-brown discoloration. And sometimes separation of the nail plate can happen in these cases. For the microscopic features of psoriasis, it depends on the stage of the disease, whether it's recent or old. And another thing, I will explain some features at low power, and some other features we need to go at higher power to mention it. So at lower power, we will just need to see here that we have increased epidermal cell proliferation, as you can see in this area, and maybe in this area. And this will result in epidermal thickening, which we call the acanthosis, and elongation of the rete ridges, as you can see here. And sometimes they describe these elongated rete ridges as this one and this one, like a test tube standing in a rack. Like, can you see this one? And all these, they are like a test tubes sitting in a rack. From this low power also, and with this proliferation of the epidermis and the acanthosis, you will find thinning of the suprapapillary plate. Like this one is thinned compared to the normal, and this one is thinned. This area also, and this area, they are thinned compared to the normal thickness of these suprapapillary plates. The rest of the features, I think it's better to go at a higher power to mention them one time. So this is the 10x, and I will just go, now we can appreciate more what we mentioned at lower power with this thinning and with the acanthotic epidermis and the proliferation of this epidermis. From the low power, I will start from deep to superficial, or as we can see here. So we have here, this is the dermis, and this is our epidermis, and this is the reticular dermis. So we will find here superficial perivascular lymphocytes. As you can see here, we have multiple lymphocytes. And also, please note the dilatation of these vessels. As we explained in the clinical picture, when we remove the scales from the top, it will cause pinpoint bleeding. And this is the cause because we have dilatation of these blood vessels in the superficial dermis, which will cause the bleeding. So I will move around to appreciate this more. Here we have again some blood vessels. They are dilated compared to the normal appearance of these vessels. And it's more evident in this area, I think, and also here it's evident. So in the papillary dermis or superficial dermis, we appreciated the lymphocytes and the dilated blood vessels. So let's go at some key features of the psoriasis. And let's see this area at this power, and then I will go at a higher power. So here we have the perivascular lymphocytic infiltration with the dilated vessels. And if we go up high here, we will find some neutrophils migrating from this papillary dermis and going up here, and they will form these micro abscesses. I will show you this on higher power. So this is a key feature for psoriasis. And when we see neutrophils in the epidermis or in this layer, we need to do a PAS stain just to exclude any fungal infection that can happen with increased neutrophilic count in this area. So this is one of the key features of psoriasis. And as mentioned, when these neutrophils, they accumulate or they are present in one area with large numbers, they can form microabscesses, and this is called the Monroe's microabscesses. We will see this at higher magnification, but I hope you can appreciate that we have here some neutrophils. Another key feature is the parakeratosis, and I'm not sure if you from this power can see these small blue dots, but we'll go on a higher power to appreciate this. And beneath the parakeratosis and these neutrophils, you will have thinning of the granular layer, which we call hypogranulosis. So here you can find this granular layer more evident, but here it will disappear. So this is another feature. Let's go at a higher power and see these features better. So I'm here at the same area, and just to mention some key features again on higher power. So this is parakeratosis. These are keratinocytes. They are retaining their nuclei, as we can see these blue dots. And we can see here some neutrophils or many neutrophils, and some of them, they form these microabscesses, which we call the Monroe's sign. And in the same area here, I will just move a bit. We have here, this is the granular layer. It's more evident in this area, and then it will disappear in this affected area. I will take the chance also to mention on higher power that sometimes we have mild spongiosis, which is some edema in the epidermis. And this is the papillary dermis, where we have this dilatation of the vessels, which causes the Spitz sign. And we have this perivascular lymphocytic infiltration in this layer or in this area. Here again, it's more evident, this perivascular infiltration of the lymphocytes. I'm trying to adjust the focus. And of course, here you can more appreciate this thinning of the suprapapillary plate. I will show you another slide with more recently diagnosed psoriasis, because as we mentioned, it depends, like the features will depend upon the stage of the disease. So this slide is for another patient recently diagnosed with psoriasis. And here we can see the overlying corneal layer. They are still having this basket wave keratin, indicating the recent onset of the disease. And again, here, these are the test tubes as if sitting or standing in a rack. So they are more maybe evident in this case. And maybe we can go on higher power just to make sure that this is psoriasis. We need to see some key features. So I moved here directly to the 40x as not to make it long. And here we can see the parakeratosis, these small blue dots, which are the retained nuclei. And we can see here these big ones, they are the neutrophils present on top. So again, in summary, just to summarize all the features we spoke about. So we have this from the low power, we can see the test tubes, or we can see the thinning of the suprapapillary plate, and we can see the proliferation of the epidermis. We can see at higher power, or we saw at higher power, the parakeratosis and the neutrophils that are present. We saw the hypogranulosis beneath the affected areas, and we saw the perivascular lymphocytic infiltration in the papillary dermis, and we saw the dilated vessels which are responsible for the Spitz sign, which is a clinical sign for the diagnosis of psoriasis. Thank you so much for watching the video. Please like and subscribe to the channel to see more videos.